Namaste. Welcome to the video on interpretation on laboratory investigations. In this video, we will discuss on thyroid function test. I am Dr. Mahesh Hirulal, Associate Professor, STM College of Ayurveda, Hassan. In previous videos, we had discussed on interpretation on complete blood count, liver function test, diabetic profile, and renal function tests. You can get these videos from the playlist. Thyroid gland is one of the very important gland in the body. It is butterfly shaped gland located at the base of the throat. It is largest endocrine gland which will secrete thyroid hormone. Thyroid hormone will play a very important role in carbohydrate, fat, protein and vitamin metabolism. It is having a role in growth and maturation. CNS development and its function is depending on thyroid hormone. Thyroid hormone is having a role in electrolyte balance. Hypothalamic pituitary thyroid axis will regulate the production, release and transportation of thyroid hormone. Hypothalamus will stimulate the pituitary by TRH to secrete the TSH, thyroid stimulating hormone. The TSH will stimulate the thyroid gland to produce the thyroid hormone. Thyroid gland primarily produces the T4. Then the T4 will be converted into the T3 at the peripheral tissue. Both the T4 and the T3 are called as thyroid hormone, which will give a negative feedback on hypothalamus and pituitary to control the production of TSH. There will be continuous positive and the negative feedback from TSH, T3 and T4 to maintain the optimum level of thyroid hormone in the blood. T4, thyroxine, is exclusively produced from thyroid gland. T3, triiodothyronine, is produced from T4 in the process of peripheral deiodinization. Quantitatively, T4 is more than the T3, but coming to the potency and the action, the T3 is having the more potency than the T4. T3 is more important because more than 90% of thyroid hormone physiological effects are due to the T3. In circulation, more than 99% of T3 and T4 are bound to plasma proteins. Only a small fraction of T3 and T4 circulates as free T3 and free T4. These free T3 and T4 are biologically active forms that will enter to the cells and exerts the effect. Specifically, free T3 is having the more potency and the more activity in the cellular level. This is the regular thyroid profile test, which will include TSH, T3, T4, free T3 and free T4 according to the newborn and the adults. These ranges may slightly change from laboratory to the laboratory and by the estimation methodology. The thyroid profile test is advised to rule out the symptoms of thyroid dysfunction, specifically hypothyroidism and hyperthyroidism. It is advised to find out the cause for the goiter. The thyroid function test is advised to rule out the infertility and menstrual irregularities. It is specially advised during pregnancy and it is used for newborn screening. The thyroid function test is advised to rule out autoimmune disorders in the follow-up of known thyroid dysfunction, and it is advised as a preoperative test. It is very important to differentiate hyperthyroidism and hypothyroidism clinically. The hyperthyroidism will be presented with weight loss, with increased appetite, the person will be hyperactive, irritable, anxious, and with the altered mood. The person will be having the heat intolerance and the profuse sweating. The person will show the palpitation and the tremors, complaints of the fatigue and weakness. On examination, we can appreciate the sinus tachycardia, find tremors, warm and the moist skin, palmar erythema, pruritus, and even the alopecia can be seen in the patient of hyperthyroidism. The major symptoms of hypothyroidism are weight gain with poor appetite, generalized tiredness and weakness, cold intolerance and dry skin, hair loss. In females, initially the menorrhagia, later the oligo and amenorrhea can be seen. Person will be feeling difficulty in concentration and the poor memory. The person will be having the depression and the low mood. Person may experience the constipation and the hoarse voice. On examination, there may be the bradycardia, dry skin with cold extremities, puffy face, edema in hand and the feet, delayed tendon reflex, and the diffused alopecia can be appreciated in the patients of hypothyroidism. To interpret the thyroid function test, we can rely on TSH, free T4, and free T3. If TSH is slightly high, free T3 and free T4 are normal, then it is a case of subclinical hypothyroidism, which is the most common presentation of hypothyroidism nowadays. If TSH is high, free T4 is low, free T3 is low to the normal, then it may be the case of primary hypothyroidism. If TSH is low to the normal, free T4 is also low, and free T3 is also low, then it is a case of secondary hypothyroidism. The cause may be from the pituitary issues. If TSH is low, free T4 and free T3 are normal, then it is a case of subclinical hyperthyroidism. TSH is low, free T4 and free T3 are high, then it is a case of primary hyperthyroidism. The interpretation of thyroid function test has to be done with the clinical diagnosis. Thyroid function test is the initial and the screening test to identify the thyroid dysfunction. The specific diagnosis can be done with the further tests like anti-TPO antibodies, TSI, TPO, serum thyroglobulin. The ultrasound of thyroid scan can be done to evaluate the structural abnormalities of thyroid gland. Fine needle aspiration and radioiodine uptake tests are used to pinpoint the specific diagnosis of thyroid gland. Thank you for watching this video. Kindly like, subscribe and share this video. Thank you.